Okay, welcome to Eastern State Penitentiary Historic Site and the Searchlight series. For the first time going out live from an empty building. I'm Sean Kelly, I'm Senior Vice President here at Eastern State Penitentiary. On behalf of our Board of Directors and our CEO, Sally Elk, welcome. I'm going to tell you a little bit about what's coming up about Eastern State Penitentiary and then welcome our guests. Eastern State Penitentiary was built on farmland outside of Philadelphia. It was built with the belief that people are inherently good, and if kept in solitary confinement long enough, they would look into their hearts and become penitent. It's the world's first true penitentiary. It has a distinctive wagon wheel floor plan that was copied all over the world. There are about 300 prisons modeled after Eastern State Penitentiary. Here's one in Mexico City, a couple of them in England. The English really loved this design. They're still building prisons like this today. This is a modern prison with a wagon wheel floor plan modeled after Eastern State. And if you play the game Sim City and you tell the computer you want a prison inside of your simulated city, this is what it gives you. The architecture at Eastern State has always been easier to talk about than the people. But there were about 85,000 men, women, and children who were incarcerated in this building over the course of 142 consecutive years. And it's always our challenge to try to remember that there were actually people who lived here. And these are real lives. They gave up that system of solitary confinement in the 20th century, and the building survived all the way out until 1971 when it closed. Today, the building is a ruin. We opened it for tours in 1994. We give thousands of tours every year to people of this abandoned building. We have art installations. This is Jesse Crimes' wonderful installation. This is a mural he made while incarcerated in federal prison, now installed at Eastern State Penitentiary. We built a graph of the rate of incarceration in US history. It's kind of our signature experience here to draw attention to the way the United States incarcerates a higher percentage of its population than any other country on earth by far. And a companion exhibit called Prisons Today, which has won many awards. And the exhibit asks questions like, have you ever broken the law? And we try to really get at the root causes of mass incarceration, why the United States incarcerates so many people in its population, and explore ways that we could be approaching these problems in a different way. Last year, we had 310,000 daytime visitors, including 28,000 school visits to the building. We're very proud of that. We are very proud second chance employers. We seek out people with firsthand experience of incarceration to be part of our education team. We find that that's a skill set that's very valuable. If, of course, none of our staff members are forced to talk about their personal experiences, but if they do choose to share that experience, we find that the ability to talk in firsthand what it's like to have gone to prison is very useful for our education team. This is Russell Craig, one of our first members of this team 4 years ago. As you might guess, Eastern State Penitentiary today is closed to the public because of COVID-19. We're closed through at least May 31st. We are rolling out a whole new series of programming based obviously all entirely virtually. And so we have a new, basically a video podcast. It'll be coming out twice a week. It's called Prisons and the Pandemic. They're 3-minute summaries of what's happening in our prisons and how the virus is impacting people who are incarcerated. Twice a week, 3 minutes long each, a quick way to keep up to date. This coming Monday night, we have a watch party of the movie 13th. You can follow us on Twitter at Eastern State, and we'll be watching the movie together. You do have to have a Netflix account, but if you can watch on Netflix, we'll all be watching at the same time and talking about it on Twitter. Next week, the Searchlight series is going to become weekly now. So next week, our guests are from the PEN America's Prison and Justice Writing Program. The program is called Temperature Check, COVID-19 Behind Bars. Our guests are Kate Messner. She's PEN America's Prison and Justice Writing Program Director, and Justin Ravilos Menson, and he's a PEN America Writing for Justice Fellow. He's a poet. He'll be calling into the program to read some of his poetry live. Michigan Department of Corrections does not support Zoom, so he'll be calling in, but we'll learn more about this program. This is a rapid response series from PEN America's Prison and Justice Writing Program, featuring original creative reportage by incarcerated writers, accompanied by podcast interviews with criminal justice reform experts on the pandemic's impact in the United States prisons. Hope you join us next week for that. If you like what we're doing at Eastern State, we do have a membership program. Our members will be meeting afterwards for a virtual reception. You can always support us at easternstate.org/support. Tonight, we are really thrilled with our guests who are joining us tonight. Andrew Cohen is senior editor at the Marshall Project, where, among other things, he compiles the opening statement, the daily criminal justice newsletter. A recovering attorney, he's also fellow at the Brennan Center for Justice and a former contributing editor at The Atlantic and a former senior legal analyst at CBS News and at 60 Minutes. Welcome, Andrew.
Glad to be here.
And Dr. Gregg Gonsalves is an assistant professor in the Department of Epidemiology of Microbial Diseases at the Yale School of Public Health and associate professor at the Yale Law School. At Yale, he also co-directs the Global Health Justice Partnership, working at the intersection of health, human rights, and social justice. For close to 30 years, he's been an AIDS activist. He's a 2018 MacArthur Fellow. Welcome, Dr. Gonsalves. Welcome to Eastern State Penitentiary's Searchlight.
Thank you so much.
We thought we would just get started with an overview. Our audience for Searchlight is always a general audience, and so many people in our audience may not be following as closely as the rest of us, how this virus is impacting people who are incarcerated. We spoke before and agreed that Dr. Gonsalves would go first. Dr. Gonsalves, do you want to give us a summary of what's happening in America's prisons right now?
So I think the first thing to say is that pandemics push people into the paths of epidemics. This isn't a new phenomenon. If you look at the history of tuberculosis, which happened to actually kill half of the people who died in Eastern State Penitentiary over the years, it was from tuberculosis. In the modern world, tuberculosis outside of the US in prisons is sort of a leading killer of people who are incarcerated. HIV, hepatitis C, sexually transmitted diseases. Prisons are not a great place to mix people and infectious diseases. I think what we're seeing in the context of COVID-19 is that the warnings went out. It wasn't just from public health folks like me. Leanne Birch, who is the Director of Corrections for the state of North Dakota and also was head of ASCA, the American Society of Correctional Administrators, several years ago, did a piece several days ago where she talked along with a public health expert saying we need to decarcerate, meaning that we need to get people out of harm's way in the context of COVID-19. COVID-19 is twice as infectious as the flu and probably 10 times as deadly. And so the reason we need to get people out of prisons is because it's almost impossible to do infection control in the context of an incarcerated population. Everybody who's on this call is trying to social distance right now. It's not really possible to social distance in the context of a correctional setting. Whether you're in a single cell or with a cellmate or in a congregate setting, you're also going to share bathrooms. You're going to share meal times and other times during your daily life in an incarcerated situation where you're going to be unable to social distance. We already know that healthcare in prisons, particularly in the United States, but all around the world, is substandard. A lot of it's privatized. There's been many exposés on the sort of state of prison healthcare in America, and so the ability, once an infection takes off within the prison, to contain it is probably remote. And what happens is that it will spread throughout the prison, and hospitals nearby who will take the cases will surely get overwhelmed with the number of ICU beds and ventilators that will have to be used by patients coming out of jails and prisons in the US. The other piece I'd mention is that, we were part of a study a couple of years ago in which we looked at the sort of plight of prisoners in Brazil and the drug war in Brazil and how the drug war is basically filling up Brazilian prisons. And what you saw is an explosion of TB in these prisons. But what you also saw is that the genotype, the genetic features of the TB in the prisons was the same as the TB outside of the prisons. So the point is that what develops in prison, an outbreak developing in prisons, is soon going to reach outside the walls because viruses don't respect cement or chain link fence. And so we have a public health imperative to protect prisoners for their own health, but also protect prisoners because an outbreak in a prison will drive infection in the community as well as inside the prison itself.
It's really interesting. Andrew Cohen, could you tell us more about what's happening in legislatures and in correctional corrections systems around the country, how they're responding or how they're not responding?
Yeah, that's a great question. And I think the fair thing to say is that a lot of folks in a lot of places waited until it was too late. And a lot of folks believe now that it may be too late, that you have so many infected people who have tested positive for the coronavirus inside prisons now all over the country, that there is some risk now to releasing them into the general population. And we're seeing a whole bunch of stories from around the country where prison guards and prison correction official unions, representatives of those unions are outraged, right? That corrections officials and governors and legislators and sheriffs in some cases who deal with local jails were tardy in not just protecting prisoners from the possibility of COVID-19, but also protecting staff and guards and the folks who go in and out of prisons and jails and then go home to their families. So this is, as Gregg said, not a surprise. None of this was a surprise to folks who are close in to the criminal justice systems around the country. There were warnings from advocates in late January, in February, in early March. People were saying to corrections officials and people who run jails and prisons, you got to do something here. Then the pandemic sort of arrives here in America. Then you see these infection rates growing, and you see reactions from people. Some governors have been proactive. I would think, for example, the governor of Kentucky has been quite proactive in trying to get and order and authorize the release of people from prisons. There have been some sheriffs around the country who have been proactive in trying to do that. There have been some prosecutors, mostly reform-minded prosecutors like Larry Krasner in Philadelphia, who have been advocating for the release of people from jails. And it's vital for people who are watching, who haven't been paying attention, who have been focused on their own lives and trying to stay healthy themselves, that the people we're talking about when we talk about releasing people from jails and prisons and immigration detention for that matter, when we talk about decarceration in the face of a pandemic to save not only the people who are incarcerated, but also the people on the outside who come into contact with them, we're talking about the elderly in prison. We're talking about people who are 80 or 90 years old in prison, or 70 or 65 years old. We're talking about people in some cases with debilitating illnesses in prisons. We're talking about at-risk and vulnerable prisoners. In some cases, we're talking about prisoners who are going to get out anyway in 30 or 60 days. We're seeing some legislatures and governors around the country who are saying, you know what, if you're going to be released anyway on June 1st, you can leave now. Get out while you can, and we're going to try to decarcerate in that perspective. Very few instances that I've seen, and I've read nearly 1,000 pieces on coronavirus and criminal justice over the past month or so, indicates that violent offenders who would cause a threat to public safety are being released. There was a bit of a hiccup in St. Louis, a bit of a question of whether maybe a couple of people may have been released who might not have been released, but the vast majority of people here whose lives may be at stake are people who probably shouldn't have been incarcerated anyway for the length of time that they've been incarcerated.
It's really interesting. It's a conversation we've been having a lot around our staff, as you might imagine. If we're able to release people from prison, if we think that it's safe, a lot of people on our Facebook page, a lot of people on our staff are wondering why we couldn't have addressed this earlier before the sickness was going around.
Well, and it's especially true of pretrial detainees in jails and immigration detainees who have not yet been proven guilty, right? Who still have the presumption of innocence and who are basically stuck in confinement, maybe because they can't pay their fines, they can't make bail. Those people in particular, you wonder how many should really be in prison, and whether when we're on the other side of this, there's a greater debate over that on the national and then the local level.
That's really interesting. I want to get back to that in a minute. I just want to stick with the health protocols inside of prisons. We found out yesterday that here in Philadelphia County Prison, there are 54 people in Philadelphia County who's tested positive for COVID-19, which is unbelievable. It's just a county prison system. 54 people have tested positive. The department has announced that staff will have their temperature taken before entering the institutions, will wear masks and gloves while inside. How effective do you think this protocol will be in preventing the spread, both between the people who are incarcerated there and also between the staff?
So we know COVID-19 can present with mild symptoms or be transmissible before symptoms develop. So the idea that temperature checks are going to be your cure-all, or giving people cotton masks to wear before they come into the prison, it's not a reasonable policy response. And basically what you see is that governors, corrections officials are bending over backwards to do the wrong thing. So the point is that as Andrew is telling us, there have been states and local jurisdictions that have decided, look, it's not worth putting people in harm's way to sort of maintain this sort of insistence that we need to keep people in jail who are at high risk of disease. And so I'm in the state of Connecticut, and the Connecticut Department of Corrections said, we're ready for this. We can handle COVID-19, hand washing, temperature checks, letting people do frequent hand washing. And guess what? We're seeing COVID-19 spread in state prisons around the state. And so the point is, it's going to be too little too late very soon. And so state prisons and jails, immigration, ICE and Customs Border Patrol detention facilities, we need to get people out and bring down the levels of inmates and detainees to a level where we can protect those who are left behind. So it's, yes, the elderly and the people with underlying conditions, but if places are too packed to institute social distancing, we're fighting a losing battle too.
Is there a jurisdiction that you can name that you think is doing a good job, where the response is adequate? Either toss it out to either one of you.
I'll just answer first.
Not meant to stump you.
No.
It's scary that's such a hard question to answer.
One of the problems as a journalist, and I think that most journalists will tell you, that has always been a problem with covering criminal justice in prisons, is the lack of transparency, right? Prison officials across the country, maybe across the world, are notorious for not exactly sharing a lot of the details of their operations inside. So it's hard to get an accurate assessment of how well prisons are doing. Obviously, some are doing better than others. Obviously, some parts of the country are doing better than other parts of the country when it comes to flattening the curve, right? And that could be a matter of time. It could be good practices or whatever. I don't know that there's one jurisdiction that has knocked it out of the park, but I will say that there are clearly some indications of the jurisdictions that are not doing it well. And one of them, it has to be said, is the Bureau of Prisons, the federal prison system. My colleagues at the Marshall Project last week broke a very important story about how a prison guard there was exposed to the virus and then was essentially ordered back to work without protective gear, infuriating him and endangering the people around him, not just the prisoners around him, but fellow workers and folks in the community. That was at the Oakdale, FCI Oakdale in Louisiana, which has seen I think the greatest deadly outbreak of the virus over the past couple of weeks. I think 5 inmates are dead. So we're seeing some examples of where it's gone wrong. I'm sure there are other examples of where it's gone wrong that we'll be able to get information about in the next couple of weeks. I don't know that there's one huge success story. Maybe, like I said, in Kentucky, the rate is down, although we're seeing some county jails there have some problems. Maybe Gregg would have more insight.
So if you go to the Prison Policy Initiative website, they actually have a updated list of sort of responses to the COVID-19 pandemic. And so we've seen more than 100 people released from Boulder County Jail in Colorado. We've seen in Allegheny County, Pennsylvania, 545 people were held in the county jail, were approved for release by the courts and physically discharged. New Jersey Chief Justice signed an order calling for the temporary release of 1,000 people from jails. And so there's actually a long list on the Prison Policy Initiative's website that can describe some of the sort of piecemeal efforts that are happening now. I think the federal question is the big one. They have the most people in detention under one sort of system, and so they're not doing very well at all. Although Attorney General Barr hinted a few weeks ago that he thought it was a good idea to get people out of harm's way, but he obviously hasn't followed through. So it's a trickle, not a flood of people coming out of prisons. The other thing to mention is that we need to prepare people for transition into the community with adequate housing, adequate health care, It's not just dropping them off here in New Haven on the New Haven Green because they come out of the state prison. It means taking care of them in the way they need to be taken care of because they're at risk for COVID, whether inside or outside.
And there's one point I'd like to just add to that, Sean, is even where prisons have made a good effort to get people out, there have been outbreaks. Cook County Jail, a couple of days ago, I read where 16% of the jail population, that's one of the biggest jails in the country, Cook County in Illinois, 16% of the people there were released. They probably didn't need to be there in the first place. Tom Dart, the sheriff, has tried to do the right thing in some cases, and yet there has been a terrible outbreak at that jail. So even where jailers, sheriffs, and others have taken steps to decarcerate, have said, you know what, these are folks that don't necessarily need to be here at this time. They haven't been entirely successful in curbing the outbreaks. And I think if you're looking for hotspots in the next couple of weeks, sadly, I think it's going to be Alabama. I think it's going to be Mississippi. I think it's going to be Louisiana. All of these states that notoriously have had dangerous and deadly and unsafe prison conditions for generations, really.
That certainly, yes, those are our prison systems that we talk about here as well. And also, those are also states where I believe that also the public response, the governors have been slow to lock down as well. I want to take a quick little historical step here. We were talking about this before you went on. Here at Eastern State Penitentiary, there was the so-called Spanish flu of 1918 was a huge, give me one moment, I'm going to share my screen here. It's a huge deal here. Let's see, come on. So 1918, when the so-called Spanish flu was ravaging the country, the people who ran Eastern State Penitentiary took enormous pride in believing that they had made life safer for people who were incarcerated at Eastern State than for the general population. So the warden at the time completely closed down the prison, only employees coming and going for 43 days. And they lost 3 incarcerated men. The photograph of one of them, Stuart Clugston, died here in October of 1918. He's 22 years old, obviously heartbreaking. They believed, though, that they had beaten the odds, and 12,000 Philadelphians died during that influenza, and only 3 people incarcerated at Eastern State. Oh, and plus an officer, important to say, an officer as well, lost his life. And we were talking before we went on air about whether or not that, it's funny to hear, Andrew, you said that it's often difficult to get the statistics. Here they are after the social distancing was lifted, the officers. You mentioned, Andrew, that it can be difficult to study prisons because you can't always be sure that you're getting full transparency. But the question I wanted to ask you before we went on was, why was it possible to keep people in prison relatively safe 102 years ago if we can't do it today? Although perhaps the answer is that they weren't doing it as well back then as they claimed to have been. Either of you have any response to that?
So it was a challenge to respond to it. And so a couple of things. Until 1913, Eastern State had solitary confinement in place. Yes, and the question is whether during the pandemic they were able to segregate inmates in single cells. 13,000 people died in a matter of weeks in Philadelphia during that pandemic, and so the real sort of rush of infection was over a short period of time. So if they could have done it over that short period of time, it was possible, and they were able to segregate patients in solitary confinement. Maybe they were able to do it in that way. Remember, Philadelphia had the worst case fatality rate in the country because they had this Liberty Loan parade that basically they did exactly what we're telling people not to do now, is to congregate in public. They went on to this parade and had the worst epidemic in the country. So you could make a case that the force of infection, the sort of risk outside the prison, was pretty damn high, and that in the context of a closed environment, which was the prison then, they were able to weather it with greater skill than they were on the outside world. That being said, again, 1,400 people died in the penitentiary over TB, over half of tuberculosis, and so well, they might have been able to sort of weather the influenza epidemic of 1918. They were not able to sort of deal with tuberculosis in the prison, which makes a little bit more sense to me. The influenza outbreak was an acute outbreak, time limited. They could deal with it, but on a daily basis, they weren't able to handle another respiratory infection, tuberculosis, very well.
I have to ask you how you knew that. That's such a relatively obscure fact. I mean, any one of our tour guides would know that. Tuberculosis killed more than half the people who died in this building, or right around half. It killed more than any other cause by far. We have a state-of-the-art hospital in this building, and it was basically entirely built to fight tuberculosis. They fought tuberculosis. They called it different things over the years, but we know now there was tuberculosis straight through. How did you know that?
You made a challenge to me about 10. No, you made a challenge to me about 10 minutes ago, and I'm like, I got to figure this out. So I'm like, typing furiously away.
I didn't challenge you. It's one to not surprise you.
No, but it did make sense to me. Now it makes total sense to me that, solitary had just been lifted 5 years before, so there's probably an ability to segregate patients, inmates in a way that you probably couldn't. The setup looks very different than sort of a modern prison, so I think it was probably a very special case. In general, prisons and infectious disease are a bad combination.
Okay, that's good to know. Do you have anything to add, Andrew?
Not on the historical context. I mean, everything old is new again. It'll be interesting. You hope in a year or 5 years, we'll have some context, right, and perspective on how deadly this was for prisoners, for people in jails, for corrections officials, for staff people, for medical people in prisons. It's not just the inmates, the offenders who are suffering here. It's the people who are in charge of them and their families and communities that serve these prisons and jails. That is, I think, also a story that's sort of ramping up in terms of its intensity. The impact that these outbreaks within prisons are having on the communities surrounding these prisons. And that is, a very intensely political question for local leaders in these areas who, have brought these prisons or jails in. They sort of drive the economy in some of these places. And I think that there are going to be some pretty significant public health problems going forward in those kinds of places.
Oh, that's really interesting. I hadn't thought about that connection of the economics. I wanted to give you a chance to respond to the concerns that some people have expressed. We see this on our Facebook page about the implications of releasing people from prison. I want to read you a quote. This is from Sterling Harris, who's with the Colorado Organization for Victim Assistance. She concludes her piece that she wrote this week. COVID-19 is a real threat, and we must work to protect first responders and those who are detained. The potential consequences of letting the wrong people out of jail early is equal, if not greater, threat. Accordingly, as we balance each of the difficult challenges presented by this crisis, we must continue to also carefully consider each individual case and its impact on the safety of the victim and of the community. You touched on this a little bit earlier, Andrew, but is there evidence that there could be a threat from people being released from prison that could outweigh the dangers of this virus and the way it's spreading?
It's a great question. It goes to the political question, really, that all these executives, prison officials, sheriffs, prosecutors, judges are dealing with. If you are going to try to decarcerate in this time, if you're going to try to save lives of people who may be vulnerable, if you're going to try to save lives of their family members and staff members, you got to figure out which people to release. I think the quote was the wrong kind of people. To my knowledge, there have been no people who have been released who are public health safety threats. I said, and I mentioned that maybe there was a little hiccup in St. Louis, and there was a bit of a controversy, I think, last week. I don't know exactly how it got resolved, that some people who may not, should not have gotten out of the St. Louis County Jail or the St. Louis Jail got out. There are some kinds of questions. So far, and it's very, very early, crime is down in virtually every jurisdiction that we've been able to measure. Maybe burglaries are up a little bit, right? Because there's nobody in any of these businesses. Maybe car thefts are up a little bit, but violent crime is down in a lot of cities. Police obviously are hampered in their public safety duties because many police officers are sick. They've been quarantined. There are huge infection rates in big cities like New York and other places. So yes, the central question about decarceration, and I think the question that has precluded many officials in local areas from releasing more people is the fear, right? That somebody is going to be released, even if it's somebody who may be vulnerable, who fits all the criteria, but who then gets released and commits some sort of a crime. It's inevitable that that's going to happen. That always happens. There's going to be some recidivism. The question is going to be whether it was worth it. How many lives spared on the front end versus whatever crimes are committed on the back end. And obviously that's an unknowable question right now as we go into it. But that's the essence of the debate. That is why more people haven't been released. The fear that, letting people out of prison into a pandemic somehow jeopardizes public safety.
Yeah, I mean, remember, I don't know the exact numbers, but, in state prisons, it's less than 50% that are jailed for violent crimes, I think. And so, and we're talking about elderly prisoners. I think in federal prisons, it's actually a smaller number that are incarcerated for violent crimes. It's like under 10%. And so we're not talking about serial killers and mass murderers or even rapists or people with accused of violent crimes. We're talking about elderly prisoners, people at the end of their sentence or due to be released. I just don't see how sort of wardens and other correctional administrators are sort of opening the doors to sort of generalized prison release under COVID-19. And I think, with all due respect to the rights of victims and the fears of politicians about being soft on crime, people are sent to jail and given a sentence, right? It's 10 years in prison, 15 years in prison. COVID-19 could be a death sentence for people. And if I robbed a grocery store and was sentenced to 10 years, I can pay my time in that way. I should not be forced to sort of give up my life because there's queasiness by politicians and the public about my right to live.
And you know what I have found fascinating, just to follow up on Gregg's point, is that there have been quite a few prosecutors and government attorneys over the past couple of weeks who have argued in court, there's no proof that conditions in a prison are more dangerous vis-a-vis COVID-19 than on the outside. Some folks have tried to say with a straight face, hey, our prisoners are safer inside than they would be on the outside if they were self-isolating. It has been surprising to me on one hand and not surprising to me on the other that there are so many people who are so entrenched in the idea that, an 80-year-old person needs to be in prison during this, or someone who has served 95% of their sentence has to be in prison for this, or nonviolent offenders, or people who are accused of nonviolent crimes who are sitting in jails because they can't afford to get out, somehow don't deserve the chance to fend for themselves or with their family members on the outside. That has been surprising to me because of the force of COVID and the way it's transformed our society. Hasn't necessarily transformed that mindset that has basically helped generate mass incarceration over the past couple of generations. On the other hand, in those instances where it has happened, where prosecutors have worked with wardens and other people to try to move some of these people out, it's been really something to see. I don't know where it goes from here. It seems to me that if the virus leaves New York City or becomes ramps up in red states where there are tons of rural prisons and jails, whether it's going to sort of change the dynamic on that. I think that's one of the open questions going forward for the next month or so.
That's a good lead in actually to the last of my prepared questions. And it's for you, Dr. Gonsalves. You've been an AIDS activist for close to 30 years, and you've worked closely with ACT UP. And I believe you've co-founded 2 activist groups around AIDS activism. Do you see parallels between the public response and the government response to COVID-19 and what we've seen with the AIDS epidemic?
Well, so look, the AIDS epidemic was about what my old friend and comrade Larry Kramer called disposable people. They were gay men, they were people who used drugs, they were sex workers. And while COVID-19 affects all of us, the people who are most vulnerable in the United States right now are people who are incarcerated, the undocumented, the homeless. And so, while the 3 of us can shelter in place and social distance, the rest of the people I've just spoken about are put into harm's way. Yesterday we were up at the governor's mansion in Hartford, We were social distancing, we were in our cars, we were driving around his mansion and saying, you need to release people from Connecticut state prisons and jails. And so, if our leaders aren't going to do the right thing, I think the lesson from ACT UP is that you speak out for the voiceless, you speak out for those who nobody else is going to speak up for. And so people who have families in prison, friends in prison, need to sort of get their governors and their local officials to do the right thing. This is not some liberal idea. I'd send people to the Appeal. It's a website at theappeal.org, and there's a piece by Bree Williams and Leanne Birch, and it's called "A Public Health Doctor and a Head of Corrections Agree. We must immediately release people from jails and prisons. Decisive actions by governors and the president can now save lives of incarcerated people, corrections medical personnel in nearby communities. Business as usual will not." And so, it's not me as an old AIDS activist or a liberal college professor saying this. It's a head of corrections in a pretty red state saying that we can't just leave people to die and get infected in our state prisons and jails, in ICE and CBP detention centers.
Thank you. Do you have anything to add to that, Andrew?
I don't. The only thing I would say, I think Gregg is right. I mean, the only thing I would say is that it's been fascinating and I guess frustrating to watch the timeline here. I think a lot of prison officials, corrections officials, governors, the decision makers, the folks who ultimately could have released people 2 or 3 weeks ago or a month ago, waited. I think even the Bureau of Prisons, the federal prison system, folks seem to wait and say, we're not going to really take this as seriously as we can until and unless the virus comes into our prison, until we start seeing positive cases, which to me is a terrible strategy. Rather than trying to prevent it from coming in or to mitigate the damage once it did come in, I feel like there was some faith, this unreasonable faith that folks were going to be protected, like Gregg said about Connecticut. And I think having waited until the virus has gotten into these places, it's going to have devastating effect. And the mitigating ability at that point, the ability to mitigate the damage once the virus is inside, is very, very difficult. So I think it's a case of too little too late in a lot of places. We'll see where it goes, but it's clearly a lost opportunity, I think, that had it been like the story of America and the lack of testing and the lack of masks and lack of preparation generally, I think that was the case with prisons too, and I think it's going to have deadly consequences.
Okay, well, we do have a question here from Facebook. It's pretty specific, so see what you think. How will outsourcing medical care look like, especially in rural prisons, where the local hospitals may already be lacking in ventilators or staff? I think, Gregg, you touched on this a little bit earlier, but do you have anything to add on that subject from a specific question from Facebook?
This is why Andrew's comment just now was incredibly important. The point is that governors and decision makers should have been releasing prisoners early on. Because once you see one case, there's 10, 20 others in that prison that have been undiagnosed. And, again, people may say, Gregg doesn't deserve to be released from prison for what he's done. But you know what? The 10, 15, 20, 25, 40 people who will get infected in that prison, who may end up at the local hospital, will just overwhelm the system, right? You're concentrating infection in a prison to amplify the infection. And when people get sick, they're going to be shifted over to the county hospital. They may have 3 ventilators. You've just sort of concentrated the infection, put it out into the community, and now there's a long line for anybody who wants to get care from COVID-19 in a rural hospital or a suburban hospital, which really has no capacity to begin with to handle the epidemic.
And don't think for a second that if there are limited resources like ventilators, and there's an opportunity between a prisoner getting it and somebody who is not a prisoner getting it, and there's going to be some backlash. There's going to be some controversy. There's going to be some conflict in those moments. And I think those moments are inevitable if they haven't already happened. When you get to a crowded rural hospital and there is one ventilator and, there's, somebody from town who needs it and a prisoner who needs it. I mean, there are going to be, right, some pretty serious ethical issues for the people involved that may turn into legal issues and clearly will turn into political issues as well.
Yeah, the political cowardice up front is gonna mean a lot of really sort of gnarly, terrible decisions have to be made on the back end that were completely avoidable.
Okay. Do either of you have any final thoughts to share with our audience? Where I think we're kind of winding down this conversation. Thank you for your candor. Any final thoughts for our audience?
So anybody who's listening to this should get on the phone with their governors, their local representatives, and push for people to be decarcerated now. As Andrew was saying, people over 65 who are at high risk of disease, anybody with sort of underlying medical conditions, anybody who's at the tail end of their sentence should be decarcerated now with appropriate sort of support and medical care when they get out. But the point is there's no time to lose. It's already been too little too late, but we need to act quickly if we're going to sort of avoid the worst case scenario.
And to that, I will just add that if you're watching this, you have some interest or concern in this, subscribe to your local newspaper, support your local media organizations, support national media organizations and nonprofits that are trying to get information and access and shed some light on what's going on inside these prisons, inside police departments, inside parole and probation offices, inside immigration detention. Never has journalism been more important. A life or death situation, especially for these people, especially for their families. I've never seen the level of desperation from the families of the incarcerated as I've seen in the last month or so. It's one thing to be concerned if your father or brother or sister is in jail and you think there's been some sort of wrongful conviction. It's another thing if that person is serving a 10-year sentence and you think they're going to die because of some sort of disease. So if you're watching this, please support journalism. It's as important as it's ever been to try to get some information to people, to decision makers, and also to the people who vote those decision makers in or out of office.
Thank you. It's an excellent point. I have a couple quick thanks. We're going to wind down. So on our team, I want to thank Jamie Martirana and Erica Harmon, who put together the tech aspects of this conversation. Thank you guys through the weekend working on this. Andy Anderson and Damon McCool from our staff put together a daily policy briefing for our leadership team on COVID-19 in prisons, which has been invaluable. Our friend and advisor, Nazgo Gonsalves from the Sentencing Project suggested Dr. Gonsalves. So thanks, Nazgo, if you're watching. And of course, our guests, Andrew Cohen from the Marshall Project, Dr. Gregg Gonsalves from Yale. Thank you both so much for being here. I hope our audience can come back and join us next week, same time, 6 p.m. Eastern Standard for Searchlight. And I hope our members stick around for the virtual reception. Thank you both so much for your time. Your work is very important, and we really do honestly appreciate you taking the time out, even to do a dress rehearsal yesterday so we get this right. You've been very generous with your time, both of you. Thank you so much.
Thanks, Sean.
Thank you. Thanks for having us.
Yes.